Evening guys. So I haven't done one of these videos in quite some time, but no better time than now to get started again. I had a very special request put in to show this very specific exercise, and this will probably be the platform again to get all the exercises started on postural correction specifically, as that is where my passion lies. But we will go a little bit deeper as we progress through the next couple of weeks to months. But for now, let's start with the most basic exercise, and this exercise is specifically to induce the core muscle, to activate the core muscle. Most of us nowadays sit way too much. We are not active as we're supposed to be. We're not moving throughout the day on a regular basis. So I have got patients, probably 50 to 80% of my patients are workers that sit driving machinery. So they operate machines. They work anything from 10 to 14-hour shifts. That they physically sit down and they don't move, or they're in awkward postures. Now, if you don't have a good core strength that's going to support your spine and protect it from the shock damage that can occur, it is going to cause some problems down the line. So my passion lies with posture correction as well. Posture correction is very, very vital for a healthy spine as well as a all over healthy body, holistic health body. So very importantly, we've got to start at the very basic and at the foundation and slowly build our way up. We can't jump in immediately, get into squats or strength training or rope climbing if we don't have a good foundation. Now, the foundation that I'm talking about is the pelvis. That is a foundation of the spine, and if the core and the glutes are weak, you're going to have a poor spinal structure going upwards. So today we'll only focus on the core strength and the core aspect. One exercise that I teach every single patient that walks through my door is called the pelvic tilt. Now, an exercise that I generally email out is called the neutral spine posture. So that is the simplistic way of looking at it, just on how to get into a neutral, corrected spinal structure or posture. But the exercise that I'm about to teach specifically is the pelvic tilt, so just the pelvic portion of that. Now, when you look at someone from the side view, we want to see the ear, the shoulder, the hip, knee, and ankle down in one straight line, and that will give us the correct spinal curvatures. And these spinal curvatures are there specifically to help us be mobile and flexible, but it is also there for protection for our spine. So it helps with shock absorption, acting as a spring between the head and the pelvis as you're going about your day, walking, running, exercising, even just sitting, operating machinery, driving over corrugation, all that bouncing, all the gravity that has an effect on your spine. It's going to compress the discs and the spine itself. So the spinal curvatures actually help to protect that and to make sure that the discs and the nerves exiting on either side of the vertebra don't get damaged. So it helps with shock absorption. So the pelvic tilt specifically, we teach patients specifically to try to flatten their back as much as possible. That would be the extreme case that we also don't want, so a straight spine almost. Then we teach them to dip that pelvis as far forward as possible. As you can see, that arches the lower back. Now, that arch would also not be good because that's going to cause tremendous stress and strain on the facet joints at the back. It can also create your erector spinae muscle on the sides of the spine to become over tight, which will also lead to pain. So what we want to find is that middle balance in between. That's called the neutral spinal posture or neutral lumbar spine posture. So the pelvic tilt is to tilt your pelvis as far forward as possible. Then you're going to tilt it as far back as possible, and again find that midway in between. Then you're going to brace the abdominal muscles or all the muscles around the spine. That is going to help enhance that core muscle strength and activation. But in essence, most people can't even get to that point where they can move the hips back and forward. So it's very important that we learn how to use that muscle first, how to do a pelvic tilt backwards and forwards, and that will teach you how to switch on the pelvis muscles and how to switch them off again. So a very simple exercise. This does work better lying flat on your back. So bend your legs, you're going to lie flat, and just exactly what we've done there, just tilting. So all you're going to do is arching the back as much as possible and try to flatten the back against the floor that you're lying on. So that is going to teach you how to move the pelvis and how to tilt the hips backwards and forwards. Now, when you tilt the pelvis back, you're going to try and tilt it as much as possible and keep it there. That helps where the muscles attached to the rib cage and to the pubic bone. So in essence, you want to shorten that area. That is activating the core muscles as well as the abs, but the main area that we want to focus on is that core muscle. So most people will struggle with this, so that's why it's easier lying flat on your back and have gravity pull you down and assist with that motion. So that is as simple as that. Now, when you get up, you can start practicing it in all positions. So in a standing position, you can go on all fours, you can do it while sitting, you can do it while standing against a wall, so getting the shoulders back, getting the head back, and then do the pelvic tilt as well. Against the wall, it's nice and easy because then you can flatten, activate that core, get the shoulders and the head in the correct position, and then you can walk away from the wall maintaining that. So you've got your neutral spine from bottom to top. You've activated your core, so the core muscle is protecting the spine, and you've got that good posture and frame that we're after. So watch out for this video next week as well.